We will not provide a CPE from TEA for the recordings. All right, so now let's get started. We have a jam-packed agenda for us today, and we're super excited to get this webinar started. So I now am going to hand it over to Kaylee Becker. She's from the Health and Human Services Commission, the Texas Targeted Opioid Response. I'm gonna stop sharing my screen, and Kaylee, you can take over when you're ready.
Thank you. Let me get my slides up. Are you able to see that okay?
Yes, perfect.
All right. Well, hello, everyone. My name is Kaylee Becker, and I'm the prevention lead for the Texas Targeted Opioid Response Program at Health and Human Services Commission. And today I'm going to be talking to you about some substance use prevention resources and programs that are available for Texas schools. Here is our agenda for today. First, I'm going to kick it off by diving into the background of substance use trends in Texas and explore the topic of fentanyl. I'll discuss the approaches and initiatives that HSC is implementing to address these issues. And lastly, I'm going to discuss some programs and resources that are available for your school and community that are designed to prevent and address substance use among youth. I will mention that I have quite a bit of information to cover today and about 20 minutes. So I may be going through my slides fairly quickly. Please know that you have access to these slides and I'm available for questions later. So first, our substance use trends. On the slide, you're going to see data from the Texas School Survey of Drug and Alcohol Use, which is an annual collection of self-reported data from students grades 7 through 12 throughout the state of Texas. And on the slide, you're going to see that substance use trends have remained relatively stable over the past 4 years, from 2016 to 2020. Alcohol is the most commonly used substance among youth, with about 32% of students reporting that they've used alcohol in the past school year. Some students are reporting that they're using tobacco, marijuana, and prescription drugs, but the prevalence of this use is relatively lower than alcohol. When I look at this slide, one of my biggest takeaways is that, yes, there are some students that are using substances, but the majority of students in our schools are not. Fentanyl is a growing concern in the United States and in Texas as well, and I'm sure you've all heard about it and had discussions about it in your schools and communities and in the media. According to provisional data from DSHS, in 2022, there were 2,189 fentanyl poisoning deaths in Texas. The majority of these deaths are occurring among the adult population. However, it is important and alarming to note that some of these deaths are also affecting youth. So in 2022, 51 of these deaths occurred among youth under the age of 18. So I want to show you a video that covers what fentanyl is, where it's commonly found, and some risk reduction strategies that can be used.
Fentanyl overdoses are happening to people like you and the people you care about right here in Texas. Fentanyl is an opioid up to 50 times stronger than heroin. Illegally manufactured fentanyl is being added to counterfeit pills that look just like real prescription medications. It's also being mixed with other illegal substances. Fentanyl is nearly impossible to detect on your own because you can't see, taste, or smell it. Even the smallest amount, equivalent to a few grains of sand, could be deadly. That means any pill could be the one that causes fentanyl poisoning. Here's how to keep yourself and your loved ones safe. Whether you want to inform your child of the risks or are worried about a loved one who uses substances, it's time to talk about fentanyl. Only take prescribed pills that come directly from your doctor or pharmacy. Carry naloxone, a nasal spray that reverses fentanyl overdose. Naloxone is available without a prescription at many Texas pharmacies. Learn more about fentanyl, how to recognize an overdose, and how you can save a life with naloxone at txopioidresponse.org.
So that was a very high level about the background of substance use issues and fentanyl issues in our state. So you might ask, well, how do we address this issue and how do we prevent substance use among our youth? And in the public health field, we recognize that there are so many different factors that influence a person's likelihood of misusing substances and developing a substance use disorder. So in public health, our approach involves reducing risk factors and increasing protective factors in our programs. So for those of you who are not aware, risk factors are characteristics in a community, in a family, school, or an individual that can elevate the likelihood of substance use. So one easy example is if a child is living in a community where they can easily access alcohol or other drugs, they are more likely to misuse those substances. Some other risk factors would be societal norms, family or peer use, and just favorable attitudes or not understanding that these substances are dangerous. Now, on the other hand, protective factors are those things that exert a positive influence and in some ways acts as a shield against the negative effects of risk factors. So examples of protective factors would be positive and supportive relationships and healthy coping mechanisms or coping strategies and self-awareness and self-regulation. So like I said earlier, in these prevention programs, what we're trying to do is reduce risk factors and increase protective factors. In 2017, Texas Health and Human Services Commission established the Texas Targeted Opioid Response Program, which we often refer to as TTOR for short. And this is a public health initiative that aims to address the opioid crisis by providing access to prevention, integrated treatment, and recovery support services all across Texas. And in TTOR, we recognize that we cannot do this work alone. We partner with government agencies, universities, and community-based organizations to deliver these programs and services all across Texas into our local communities. So on the screen, you're going to see an image of the types of programs that we fund across the continuum of care. If you're interested in learning more about our programs, you can go to this link on the screen or scan the QR code. You'll see a blurb about each of our programs and see the outcomes. But in this next section of the presentation, I'm going to go over the programs that TTOR offers that can specifically be used for schools. So first is our opioid surveillance dashboards. And in my eyes, this is really the foundation of what we do, because we need data to understand how the opioid crisis is affecting our state and which groups are most heavily impacted. So we work with the Department of State Health Services to provide access to data dashboards. So anyone can access these and get data about drug-related deaths, including fentanyl. You can see different surveys like the Burford survey and the Texas School survey that we talked about earlier. You can also see data on emergency department visits, poison control calls, and the prescription monitoring program. All of this is interactive, so you can get on and filter by the time period, by your region or county, and by demographics. I see that a lot of people use this to understand what's going on in their own community, but they also use this as data for their presentations or in grant applications. So this is a really great resource. And I do want to make sure that you're able to navigate to the dashboards. So if you go to the healthdata.dshs.texas.gov, you'll see this page. And what you want to do is go to the very top and click drugs and alcohol and scroll all the way down to opioids and click that link. It's going to bring you to a landing page of all the opioid related dashboards that we have available. Next is the PACS Good Behavior Game. This is our upstream prevention program that's implemented in schools, and it's not a curriculum. Instead, it's a set of evidence-based strategies that are used by teachers in their normal interactions with students. And these evidence-based strategies are designed to build children's self-regulation skills, giving them the ability to manage their own thoughts, feelings, and behaviors. This has been tested and been shown to improve classroom behavior, academics, and it's been shown to reduce substance use later in life, which is why TTOR is funding it. We partner with Education Service Center 13 to offer PACS Good Behavior Game trainings to educators in schools throughout Texas. So if you're interested in a free training, you can go to this website, texasgoodbehaviorgame.org, to learn more about it and to register for the training. Now, we know that some schools would like curriculum in addition to implementing the PACS Good Behavior Game. So at HSC, we have a sister program that's called the Prevention and Behavioral Health and Promotion Program, and they offer additional substance use prevention programs for individuals, families, and communities. So they have three different programs, including coalitions, prevention resource centers, and youth programs. If you want to learn more about these programs and see which ones are offered in your region, you can go to this link on the screen. But today I want to focus specifically on those youth programs. These are offered by several providers in Texas, and they deliver evidence-based prevention curricula to youth and families. There are different types of curricula that they offer depending on the population. So we have universal programs that are more appropriate for the general audience, selective that are for groups that may be experiencing one or more risk factors related to substance use, and then indicated, those are tailored to youth who may have or are very close to initiating substance use. And these are the prevention curricula that are offered. Like I said, if this is something that interests you and you would like to see this in your school, you can go to the link that I shared on the previous screen to see which providers are available in your area to deliver these curriculum. Now, like I mentioned earlier, fentanyl is a growing concern in Texas, and in 2022, Governor Abbott called on several state agencies, including HGSC, to increase our efforts to address the fentanyl crisis. So in response to that, our communications office developed and implemented a fentanyl awareness campaign that's called One Pill Kills. And this aims to raise awareness of the dangers related to fentanyl, and it features testimonials from families who have been affected by this issue. So as part of this campaign, we have the Fighting Fentanyl website, which is onepillkillstexas.com. And it offers a variety of resources that could be helpful to schools. So of course we have educational content in those testimonial videos that is shareable. But we also have a social media toolkit with messages and graphics that you can use on your Facebook or Instagram or whatever social media platform you have for your school to start raising awareness about these issues with the students and families. We also have a broader awareness campaign that raises awareness of the dangers related to opioid misuse in general and risk reduction strategies. As part of this campaign, we have a separate website, which is txopioidresponse.org, which offers even more resources for schools. So here you can learn more about opioids in general and the risk reduction strategies. We also have shareable videos that you can incorporate into your presentations or whatever educational initiatives that you're working on. We have social media guides and PowerPoints that can be used to educate communities about prescription drugs. One of my favorite resources that we have is conversation guides. So we recognize that it can be hard to talk to a young person or, even an adult about opioid misuse. So we have conversation guides and videos to help, guide you in that conversation. So I want to show one of the videos that we offer.
After recovering from an injury, I never thought my leftover pain medication could contribute to my son's addiction. It turns out he had taken opioids at a party, liked the way they made him feel, and turned to my medicine cabinet for more. Some early signs of opioid addiction are medications going missing, taking more than a doctor prescribed, or needing early refills, and taking or buying pills from other people. For my son, I started to notice that his behavior was just different. I was afraid he'd be upset with me. but I knew I needed to talk to him before something bad happened. I chose a time when I thought he was sober and asked if we could talk about something important. I tried not to get upset and spoke from my own perspective, sticking to I statements like, I've noticed you aren't yourself when you take opioids, and I'm worried about you. I wanted my son to see how those pills got in the way of the things he cares about. So I talked about how he'd been missing work and stopped coming to our family dinner on Sunday nights. He got pretty defensive, but I didn't take it personally. I was not going to give up. I reminded him that as his mom, I will always love him. A few days later, I brought up a family friend who struggled with addiction and is now in recovery. By talking about a friend, we could talk about my son's behavior without him feeling attacked. It took several conversations, but eventually he opened up to me about what was going on. I did my best to listen more than I talked, without criticizing or interrupting. So we made a plan together to get help. We set up an appointment with his doctor, who referred him to treatment and prescribed naloxone, the overdose reversing drug to keep in the house. Talking about addiction is hard, but don't worry about saying everything perfectly. Life-saving conversations start with a few words. To get help, visit txopioidresponse.org. Just Talk Texas.
So that's just a preview of one of the resources that we offer on that website. Few more before we wrap up. So for our safe drug disposal program, this is an evidence-based strategy to prevent opioid misuse by reducing access to prescriptions in the school and home. So we work with the University of Houston to help Texans safely dispose of their unused, unwanted, and expired medication to reduce access. Now, I'm sure that many of you are familiar with the DEA drug take-back days that happen twice a year. That's a really great initiative. What's different about this is that it is available 365 days a year, because instead of going to a specific location to drop off your medication, the University of Houston provides materials that you can use in the school or in the home to deactivate the medications or to send them back to an incineration facility. So if your school is interested in these materials, you can scan this QR code to request them for free from the University of Houston. We have a lot of schools participating in this already. We find that some school nurses requested materials to dispose of medications that are left over in the school at the end of the school year. And we also see that schools are passing these out to families. So if you're at all interested in this, please feel free to request those materials for free using that QR code. Now, with opioids, opioid overdoses are possible and they are life-threatening. However, it's really important to recognize that they are preventable and reversible using the medication naloxone. So this is a medication that reduces opioid overdoses, including fentanyl. And it's most commonly used as like a nasal spray. It's often referred to Narcan, or there's other different brands. And like I said, you can use that to reverse a naloxone or opioid overdose that occurs. It does not have any effect on someone who does not have opioids in their system. So if you suspect that someone is overdosing, it is best to give naloxone just in case and to save their lives. I know that there was a recent bill that passed requiring certain schools to have a naloxone administration policy for their campus and district. So if your school is in need of a standing order to distribute naloxone, we offer that at this TextSavvy.org website. You can go on there, put in your information, and the University of Texas at Austin will provide that freestanding order to distribute naloxone. And we recognize that you'll need naloxone on hand to stock in your schools. There are different places to get it. Of course, you can get it through a local pharmacy. It's now available over the counter. If you need naloxone for free, you may inquire with your local county sheriff's office, who most of them have access to naloxone through the opioid settlements, so they can be a resource for you. TTOR also contracts with UT San Antonio to offer naloxone at morenarcanplease.com, so you can place a free naloxone request there And of course, you can purchase on your own through the naloxone manufacturer. If your staff needs training on overdose prevention and how to use naloxone, we also offer training at the link on the screen. So UT San Antonio offers that training for free and virtually. And there's different trainings depending on your needs, but that's the best resource to go to if you're in need of training. All right. If you are aware of a student who may be in need of treatment or recovery, I encourage you to refer them to an OSAR, which stands for Outreach Screening Assessment and Referrals. These are incorporated into the LMHAs across different regions of Texas. So you can refer your student there or a family there. And it's a starting point for them to get access to treatment and recovery in Texas. And the last resource I'm going to share is Heroes Helpline. So I'm not sure if there's any school nurses or law enforcement on this call, but we recognize that you all have a very difficult job and it's very stressful. If you all are struggling with substance use issues or need mental health treatment, there is help available for you as well. We fund a helpline that's called Heroes Helpline. For free. So you can call this number 833-367-4689 and get help 24/7. And with that, I will wrap up. I think if you all have questions, please put them in the Q&A box. And I think we're going to, address those later on in the meeting.
Awesome. Thank you so much, Kaylee, for sharing such important resources from our Health and Human Services Commission, and definitely appreciate you for that. Much like what Kaylee said, if you all have questions for her or want to know more about her resources, please add those questions into the chat. She's going to stick around for us, and we have some time budgeted at the end of the session today to answer Q&A from our panelists. So if you have questions for Kaylee, please put them in the queue. Please use the Q&A function for that. Now I will go ahead and transition us to introduce Barney Fudge from the TEA, Texas Education Agency's curriculum department, to discuss some bills passed from the 88th legislative session related to fentanyl awareness curriculum. Barney, you can go ahead and take it over now.
Good morning, everybody. My name is Barney Fudge. I'm the statewide coordinator for health education and physical education in the curriculum division at TEA. I'd like to thank everybody for having me today and for coordinated efforts with cross divisions and across agencies here today to talk about all of the fentanyl awareness, abuse use, and fentanyl awareness month that's going on today. And Ashton, I don't know if I have the conch in reference to Lord of the Flies here, if I have power or not to show my screen or.
Yes, sir, you do. You can definitely share your screen if you'd like to.
All righty, wonderful. Let's see. I'm lost here because usually I'm on the other side. Where?
Yeah, so if you look at the bottom of your screen, kind of like where your face is, there's a button that says share screen. That's like a little green.
There we go. Got it. All right. So there are two places. So House Bill 3908 passed several different things for fentanyl awareness. And one of those was it signed into law Texas Education Code 38.040, which talks about fentanyl awareness instruction for grades 6 through 12 that has to be offered on an annual basis. And then also other information, what we're talking about today, Fentanyl Poisoning Awareness Week was also part of that bill. And then in a separate bill, there was also information about Fentanyl Poisoning Awareness Month. And any of the resources that are on the agency's Fentanyl Response Communications Toolkit could assist districts in communities with Fentanyl Poisoning Awareness Week and month. But what I'm here to talk about today is the instruction aspect of it. And on this page, on the Fentanyl Response Communications Toolkit page, the easiest way to get to this page is if you just went up to the search box here on the TEA webpage and just typed in fentanyl. That's the quickest way to get to the Response Communications Toolkit. But if you scroll down here, it's got some posters and some awareness information that districts can use. But then coming down here, we were given a directive to identify essential knowledge and skills in the health TEKS that would be aligned to fentanyl abuse prevention and drug poisoning awareness. And you can access this document from the Fentanyl Communications Toolkit, or you can also access it on the health education webpage off the main TEA webpage. So how to access it off the health webpage is you just go to the main TEA webpage, click on the letter H, and then just go to health education, and then it's right there at the bottom of the health education webpage. So it's the same document. So we'll just access it from right here. And what we did, the education code identifies several different things that are in there, but our directive that was given to us in the curriculum division was just to only identify those essential knowledge and skills that would identify fentanyl abuse prevention. And so that's what we did. There was there's other information in the statute, but our directive was just to address only those that would apply to fentanyl abuse prevention. And the statute says grades 6 through 12. And as you will realize, this starts in kindergarten. Again, that was our directive that was given to us. The statute requirement says that instruction is to be provided on an annual basis to students in grades 6 through 12. But the directive that came down to our division was identify any essential knowledge and skills in grades K through 12. So that's what we've done here. And I just wanted to point out that this document is available. This can be used as kind of your guiding document for the classroom when students are in health class, whether it's how, instructional arrangement is a local district decision for how it's taught in elementary. If it's taught, in a breakout, if your district is that big, you teach it as a breakout, or if it's taught by the general education classroom teacher. So I just wanted to point this document out and let folks know that it is there and that it identifies where fentanyl abuse instruction could be addressed. Now, it doesn't specifically identify fentanyl, but the student expectations and the knowledge and skill statements that are addressed, it would allow where fentanyl instruction or instruction about fentanyl abuse could be addressed in here, but the TEKS themselves and the student expectations themselves do not specifically identify fentanyl, but this document does identify where fentanyl instruction could be introduced in the TEKS. And again, it starts in kindergarten and goes all the way through junior high into high school. So I just wanted to point out that document is there. And again, it is on the Fentanyl Communications Toolkit webpage and is also on the health education webpage. And as our presenter that just finished just a minute ago, I'll hang out through the remainder of the webinar. So if anybody has any questions, I'm here to address and answer. And mine was short and sweet.
I appreciate that, Barney. Thank you so much for taking the time out and joining us and hanging out for any to answer any questions. Again, you all are definitely able to use the Q&A function. I see a few folks already utilizing it right now. So if you have any questions for Barney, you can definitely feel free to put your questions into the Q&A function as well. So now I will hand it over to our fearless leader over here on the mental health and wellness team at TEA, Julie Wayman, the director of our team, to touch on a little bit more about the fentanyl response communications toolkit, much like what Barney just showed you, to kind of talk a little bit more about its relationship to school mental health, and even more so how to put it into practice as well as a small introduction to our curated resources that we have around fentanyl response and substance abuse prevention on our schoolmentalhealthtx.org website.
A little bit of a quick tour. I'm only going to talk for a second about a couple things. I think Jolene on our team is Jolene Gibbs here, and Tammy Genke, who's having some Zoom issues. I think she had to jump off for a sec. She'll be back in Ashton helping to drop things. So we'll make sure we share as many links as we can. I did want to just give you the overview of the poster that is available for the governor's designation of this week. Of course, if you have that, everything in this toolkit is optional for you to be able to use. But I wanted to point out where it says there's all kinds of social media assets. I know some of your districts are doing social media, and some of the ESCs are doing some social media. I know TEA is putting out a lot of these social media messages this month and this week. So I wanted to let you know that those are on there. A lot of our parents, our families, our communities pay attention to social media. So our communications department developed a lot of collateral specifically for this month, and you can use those freely as you would like. Under more information, we talk about a fentanyl poisoning awareness month one-pager. And I think the one-pager, if you can click on that, Ashton, is a nice way to kind of just give you a little bit of overview to what this is about. And we were charged by the governor to start working on this back last October. So we have worked with Kaylee and her team over at HHSC with our regions, with our communications and curriculum department, just to put together some messages and some information and some of the data that Kaylee talked about. So we don't have current data on here right now, but data on the data dashboard is appreciated from our Texas Department and State Department of Health. But the fact that we did have 1,672 deaths from this in 2021 was a huge concern and continues to be. This one pager just gives you a few high level points of the data that you might include on any presentation, but there's also 5 actions here that you can take now that we wanted to highlight for you real quickly. You can look at our number one at our curated resource list that we put together with our partners at the other state agencies. And if you click on the highlighted hyperlink of fentanyl awareness and prevention, you will come up with a link of various curated resources. First, you'll come to all kinds of resources and you'll scroll down to fentanyl awareness presentation. And there, if you click on the first tab, you'll get a curated list for schools. And this is just another starting point, even though Kaylee already gave you so many of the top level resources, feel free to scroll through this list. So you've got the TEACS guidance that Barney gave you. You have this list from some additional resources that you might want to look for from trusted, from SAMHSA, the Substance Abuse and Mental Health Services Administration, from the DEA, from HHSC. Some of the videos that Kaylee showed are all hyperlinked in here. The drug disposal is totally optional, but we want to make districts just aware of it, that it's all there. And our best practices list, where we have some other resources that are available, and we'll click on that in a little while. But so just make sure that you look at any of these links if you're the person that's kind of planning what you might do, whether it's with students or parents or faculty. We have some different tools here. So jumping out of that, thank you, Ashton. A lot of different pieces there. Then number 3 on the one pager, we focused on the prevention resource centers. in Texas. And that, I think, is a very underutilized resource in our state. Oftentimes people don't realize what Kaylee talked about, that these services are available and funded through HHSC, and they're available all through our state, right? So we don't have to do it all in schools, but we can count on our collateral resources out in the community. So feel free to reach out, introduce yourself, meet the prevention resource folks. And Kaylee gave you the exact link to that. We also have it in the curated list. So reach out to them. They can do awareness activities for students, for classrooms, for faculty, and for parents, depending on which center we're talking about. So see what's available in your community. Number 4, we did link to all Kaylee's resources over at the Texas Opioid Response at HHSC, so you can explore those. And these websites are good to bookmark, because what I find is new resources continue to be highlighted and updated. So for example, our fentanyl page, right, with those curated resources Ashton just scrolled through, we're getting ready to update that again with a few new resources. So just bookmark it and come back to it. We're trying to keep some things all in one place for you. But the good place to access is it right here through this one pager. And then our resource database was number 5. Kaylee talked about treatment. She talked about all the components, as did as Barney. We've got recovery, we've got treatment. And here our education service centers do identify, they're just beginning. They're going to be refreshing this again soon. So this is another resource database we'd love you to bookmark, because here you're going to get some regional resources for recovery, for treatment, for prevention, as our education service centers identify all kinds of mental health and substance abuse resources. So this can help you with your fentanyl, it can help you with your substance abuse prevention writ large, and your prevention, protective and risk factors, right? We're trying to build strong communities and school environments to add those protective factors that Kaylee talked about from research into our communities and into our schools. And when children and families need more, we're here to help make referrals and connections to more. So another great resource for you there. So just clicking back out to the toolkit, just so that you know it's there. I will go down under correspondence templates as you scroll that page for the communications toolkit. We don't have to go back to it right now necessarily, not that one pager, but the toolkit itself does have sample letters just written that you can edit, use for yourself, for parents, for faculty. Say you want to do a workshop night, bring parents together. I've heard some great things districts are doing around that. We don't have time to showcase them all, but we're going to showcase some other things for substance abuse prevention and everything writ large with some districts. So what I'm going to do is quit talking and let you know that all of this is here. Oh, and that one more link right there, that the curriculum department, our government relations, we work in the Office of School Safety and Security. And we work with the curriculum department on all of these things. So we have a unified voice at the agency that we want to prevent these harms, right? And so this kind of goes through the bills that Barney was talking about, gives you a little more information, another way to access the guidance on the TEKS that Barney talked about, a way that you can reach out for more questions if you have them. So just another resource that Jerlene is dropping that link into the chat for you. And so you should have a lot of unified resources all together from TEA. Let me, without further ado, Ashton, get back so we can get our other guests highlighted. And I want to thank you all for joining, because it's all of you caring, it's the caring adults in the school, in our communities and our families that make the difference. That's what it's all about. It's all not all laid out for us, really easy and simple. We know it's hard, but thank you for everything you do to just lean in and provide those protective factors that we want for our children, our schools, our families. And thank you guys for being the leaders, and everybody here on this panel and everybody in this room today that took the time to join. Okay, Ashton.
Awesome. Thank you so much, Julie. Oh man, all great resources, right? But one of the things that we do know is, right, it is important to see all of these resources in action, right? Put to practice. So we do want to make sure we highlight some phenomenal folks working in the field at at school districts, at ESC regions, who are doing a really great job with utilizing these resources and utilizing their own community partners to be able to provide these types of services for students and their families. So I am going to introduce some phenomenal leaders from out here in the Houston area. From Channelview ISD and the Bay Area Council on Drugs and Alcohol to share their successes from their partnership to provide drug prevention programming to students in Channelview ISD. So without further ado, I will turn it over to our Channelview ISD team in Bakota.
Thank you so much, Ashton, and good morning, everybody. Thank you, TA, for having us today and allowing us to share with you all. I'm going to try to share my screen. Okay. So we are definitely very fortunate and grateful to have been able to create a partnership with our Bakota team. They're family to us now because we have had this partnership for almost 6 years. So today I have here with me Becky Morales, Benita Fernandez, and Francisco, who is really a big part of our team and our family because he is actually working in the district with us. So they're going to give a little background, but I just want to start off and kind of talk about just the history of this partnership and how it began. It did start out about, like I said, 6 years ago. We had a former employee in the district who actually was very concerned at the high numbers of students that were being placed in DAEP for substance abuse. And so she knew about the Bakota program and definitely connected and thought that it would be a great idea for us to bring some of their services into the school system. And from there, we noticed that we continued to see that increase and knew we had to do something about it. And so that's kind of how the partnership was birthed. And from there, we created ways to make it a permanent in the district, which I know my Bakota team will get a little bit more into how we made that happen. But from the district side, we as a district of innovation were able to use Title IV funds, those supplementary funds from Title IV to partner with Bakota and bring Francisco on as a full-time member in our district and on our staff. So I'm not going to keep on talking because really the meat of everything lies within this partnership that we have with Bakota and all of our successes and impact. So they're going to cover some things like, you know, some challenges that we faced. We have had many success, cover kind of like what the program looks like in our district and just how we communicate and go about reporting and making sure that those needs that we identified and we identify each year are addressed. So I will turn it over to Becky.
Yes.
Okay.
Good morning, everybody. My name is Becky Morales. I am one of the directors at Bakota, Bay Area Council on Drugs and Alcohol. And basically, as Dr. Wilson stated, the district approached us because they recognized a need for services. And so we started looking at what they wanted. We realized that with our state-funded program, we were in our last 5-year cycle and were fully at capacity in terms of staff and budget and couldn't bring them in under that state funding umbrella. So we developed a tailor-made program just for Channelview. They provided the funding and they provided the knowledge that we needed about their population. And what we recognized is they're the experts on Channelview and Channelview students. We're the experts on prevention. It was really such a great match when we met and started discussing the challenges and what was needed. They knew what they needed. They knew their level of readiness. And so we applied our strategic prevention framework, which is one of our best practices, one of the tools that we use for level of appropriateness, and determined that the Botvin's life skill curricula is the one that matched best for their needs. And so that is the curricula that we implemented under their funding. about a year later, we received we received another 5-year grant from the state. And because we did have so much buy-in from Channelview, we went back to the table and we offered to provide, so the Channelview funding provided for a high school prevention specialist. The state funding, what we offered was a prevention specialist at the elementary school and at the middle and junior high schools. So they got a full comprehensive program on all 3 levels with 2 different funding streams. So we were able to implement 2 more staff. Along with that, as Kaylee said earlier, the curricula that we use addresses risk and protective factors. So at the high school level, we use Botvin's life skills. And at the middle school and junior high, we use positive action. I know there are questions about curricula. So we'll answer those as we get to the end. Again, part of what has made us so successful is that we are able to have honest relationships. We have really good, honest conversations, and we have really good relationship with Channelview. Some of our challenges have been the weather. Obviously, we all experience hurricanes and tornadoes. I-10 has a lot of chemical plants. And so along with that, some of those things that came into place. And of course, all of us experienced COVID, which did allow us to offer some counseling virtually for the students. I'm going to stop so that we can really get to the meat of what's working. And I'm going to pass the baton to Francisco, and he's going to speak on what that program looks like in Channelview, boots on the ground.
Yeah, thank you, Becky. So my name is Francisco Ramirez. I'm a licensed chemical dependency counselor intern here in Channelview. I work with both high school, Channelview High School and Endeavor High School. I provide substance abuse counseling as well as prevention services. And I think what has really worked here is that Channelview really makes sure that students are getting all the services they need. Here at the high school, if students are caught vaping, they have to attend 10 sessions with Bakota. After those 10 sessions, it's only optional for students to continue meeting with me. Most students do want to continue having that support. They know that recovery is very challenging, and for them, it's really hard to talk about substances with family members or friends. So having someone in the school district that can really, they can really come to my office and feel safe in a private setting, they know that they can benefit from that, from those services. And not just students, I also have parents who are always reaching out. For the past 2 years, I've had a parent who always emails me or calls me, ensuring that his student is getting services. That parent has been through recovery himself, so he understands the need of having a support system in recovery. And I think I have to give credit where credit is due. All of the work that I do is because of the support that I get from the counselors, the school administrators, the staff here in Channelview. Here at the high school, I work very closely with Ms. Johnson. Ms. Johnson is the social emotional support counselor. She's always there to refer students to the program if they are having troubles with substances. And she's always there to, when I need support too, if I ever have a student that I don't have the skills to provide services to, I know that I can always refer back to Ms. Johnson. And I think just personally having someone that you can always, call for anything is really important. That's here at the high school. At Endeavor High School, Mr. Sims, the principal, is really good at making sure that I'm being part of the support system. In that school, they have something very special going on. Every Friday, they have an activity period for like an hour. Students are able to just relax and engage in different recreational activities. And Mr. Sims always invites people to do different presentations and again, a lot of different activities with the students. And he lets me be part of that, of all of that. And students really see me as a support system and less as a punishment. I think the work that Ms. Johnson and people like Mr. Sims are doing here in the district really helps students advocate for themselves and really helps them understand that it's okay to not be okay. It's okay to ask for support. And not just the students, like I said, the parents of the middle school and elementary schools have been really good at making sure that we're getting connected with parents. Yeah, at those levels, we do a lot of parent presentations. So we talked to parents about the different trends we see related to drugs. Parents were able to ask questions and really bounce ideas from each other. And importantly, understand that they're not alone when dealing with these things, and understand there's a support system here in the district. I think my favorite memory here in my work was when one of the elementary schools, Crenshaw Elementary, invited us to do a back to school car parade. So we were able to drive around the community, get to know the families in a different setting. I know someone was mentioning in the comments that they wanted some ideas for younger grades. We at Bakota do a lot of puppet shows. We really, work with the counselors and school administrators to really adapt everything that we offer to the needs of each student. As someone who grew up here in Chattanooga, I am very proud to work here, and I'm very proud to see how the district handles different situations and the needs of each student. Becky, Benita, do you guys want to add anything?
Francisco, phenomenal job. Thank you. My name is Benita Fernandez. I am one of the directors of YouthWorks also. I'm the coordinator between the district and our staff that's in the school district. So I keep in touch with the district about data communications. We have a very good communication relationship with Channelview, and it's helped us develop the program as they want it to be and as we need it to be. So that's been really good. Data, we have looked at the data that we provided to them for their funders. We've had to make some changes, but we've adapted, and that's my role with Channelview. Thank you.
Again, we are very fortunate and grateful for the partnership that we do have with Bakota. They have been awesome in just being sure that we are providing those services, prevention, intervention for our students. And we're just thankful that it's been a long-standing relationship, and we hope for it to continue. Again, thank you all for having us today. There's the information for Becky and Benita. If you have any questions for us, we'll be around as well to answer those. Again, thank you.
Awesome. Thank you so much, Dr. Wilson and Bakota team. I think I might be able to speak for our team and say that the work that you all are doing is definitely phenomenal. I really appreciate one thing Francisco said as well, in terms of, right, like the families and the students see him as a partner and not as a punishment. And we also had someone in the chat give you all kudos because you all saw a need in your district, and you ended up creating a fantastic partnership to be able to fill that need. So definitely kudos and much appreciation to you all for taking the time out and sharing with us today. So now I'm going to transition us over to our next set of presenters to round us out. So we have Jenny Yannick from ESC Region 12 based in Waco, Texas, and Christy Bryan, an elementary school counselor from West ISD, to highlight one of the largest and most successful Red Ribbon Week initiatives in the state. Super excited to hear about how that is going for you all, and another phenomenal example, right, of like seeing a need, seeing some energy and momentum in the community, and a school district, an LEA, creating a partnership, right, between their ESC region to fill that need. So I'll turn it over to you, Jenny and Christy, to kind of round us out with our presenters.
All right. Thank you, Ashton. We appreciate the opportunity to be with you today. Greetings from Waco in the heart of Texas. The silos are doing well, and there's construction all around. So Chip and Joe are doing fine. We are really excited about another year that we have had the opportunity to participate in what is now a tradition in the heart of Texas, and that is a Red Ribbon Week wristband campaign. And upon first glance, it may seem like it's a probably nice little benign thing. It's obviously in honor of Enrique Camarena from 1985, whenever the Red Ribbon wristband or the Red Ribbon campaign actually started. And a simple red ribbon, it was used to honor him and his sacrifice in that line of duty as a special agent. And that has been carried on for years here in Region 12, because we have had wristbands that have been delivered and shared with us every year, sometimes from different partners, right now from the Texas Joint Counter Drug Task Force. And yes, I had to practice that before saying it. But our partners from the Department of Defense with the Counter Drug Task Force have provided usually around 70,000 wristbands each year, and have done so with us with the region for the last 11 years. But the tradition really goes on much longer, probably another 10 to 15 years before Region 12 got to step in and help distribute. So there are whole generations now of Texans in the heart of Texas who have grown up through our schools with the Red Ribbon wristband campaign. And this year, and I'll just give you a little bit of numbers on that. So not counting those 10 to 15 years before, with Region 12 in the last 11 years, we've distributed over 860,000 Red Ribbon wristbands at the rate of about 70,000 a year. We are on track in 2026 to deliver our millionth Red Ribbon wristband in the heart of Texas. We're going to have a really big to-do when that happens. Our partners with the military and the Counter Drug Task Force are even saying they're going to drop it in by helicopter. So how cool would that be to celebrate that? And what we love most about this tradition now is how much we see our counselors, our leaders, definitely our students as they are participating in this, even through COVID. Before I turn it over to Christy, you remember COVID? What did we have to do? We did a drive-through Red Ribbon wristband distribution where we were able to use a warehouse. So nothing has stopped Red Ribbon wristband in the heart of Texas. What I am going to do is show you real quickly. This is what the Red Ribbon wristbands look like. And we have them in sheets. Those sheets are packed in large boxes. We have a count out day after we do orders. And the counselors can just, or the administrators, whomever takes them off, they put them on our students. They say Texas Joint Counter Drug Task Force, Protect Texas, Stop Drugs. So like I said, kids in our part of the state have grown up and know every October we're going to celebrate Red Ribbon, and we are going to make our commitment to be drug-free, and Region 12 is helping with that. So Christy, I'm going to just share a moment with you to talk to everyone about what this means to you.
Hi, everybody. As you can tell, I am in a counseling office, elementary school, in case you're wondering, elementary level. And we get the wristbands every year, and for us, it means a lot. It goes along with, of course, Red Ribbon Week. We talked to the students a lot this week about making healthy choices for themselves. And our vision statement here is serve, lead, grow. And we talk a lot about growth during Red Ribbon Week and how you need to make healthy choices for a healthy lifestyle, put only good things in your body. And we just appreciate working with the Region Service Center and how they always include us on this, because especially with the littles, we get the red ribbons some years as well, and they fall off or they lose them, and the wristbands stay on, and a lot of kids will keep them on all year. I know my son is a senior, and he has grown up with this at West High School, every year having a red wristband, and he'll keep them on until they fall off. So it's just that reminder that's always with them and always on them to make good choices for what's best for themselves in their future.
Absolutely. And I see in the chat, there's some great questions. Partnerships is the answer to that. The amount of red ribbons that we get from our partner with the DoD right now is a finite number. And we do have a claim system, but we've always been able to help and take care of our districts with the amounts that we've been given. But I will tell you, if you're wanting to start something in your school or with your partners in your region or area, the community is very supportive generally. And when you find that partnership and you you know what your needs are, what you can do to support one another. That can be something that grows individually. I'm often surprised sometimes just with a phone call when we reach out and say, hey, this might be a neat way we can show support for our school, and here's what we have in mind. And then your partner in the community or business might say, okay, what does it take to make that happen? What kind of contribution can we make? How can this also benefit us? A lot of times from an advertising world, if they know that students have something that's going to be beneficial and it has their name on it, then they know that it's also seen. But it serves our purpose because it means that the kids get to have something that really ties their intention to their pledge, which is being drug-free. So answering that question for you, it would be wonderful if we had a whole statewide initiative. We'd have to have 5.1 million red ribbon wristbands. I'd love to see that. But do reach out to start your own red ribbon campaign or have something that becomes a staple, because when it becomes a tradition, it means that now we have teachers who grew up and are teaching in our schools who had red ribbon wristbands in the heart of Texas. And we even have people who are working here alongside me, and they'll say, I remember having my red ribbon wristband growing up and pledging to be drug free. So and you can order these if you wanted to start your own campaign to do this. You can probably find them for anywhere. They have that, that kind of concert feel. These are very durable, like Christy just said. So the kids are committed to that. But we have enjoyed this, and Region 12 is really proud to help keep this tradition going. And stay tuned for 2026 for that big million band party, because it's gonna be a big splash.
Awesome. Thank you so much, Jenny and Christy, for taking the time out to share with us about the red ribbon wristband. Ooh, it's a little bit of a tongue twister itself. The red ribbon wristband initiative. So now we will go ahead and move on to our final portion of the session, our Q&A portion. So we have a lot of phenomenal questions in the Q&A chat, in the Q&A function. Before we move on to that, I know some of you may be logging off a little bit early. I want to make sure that you do your post survey before you jump off. So I'll put that in the chat again as well. So if you do have to log off a little bit early, please remember to do that post survey. That really helps us make sure our sessions are good for you all and helps us with our funders as well. So now I'll actually go ahead and pass it over to my colleague Tammy to facilitate us through this Q&A function. And it seems like we still have all of our presenters on to answer questions. So definitely looking forward to that, and passing it over to you, Tammy.
All right. Wow. Amazing presenters. Phenomenal. And your questions are great. And so what I'm going to try to do is, just for time's sake, I'm going to try to just summarize some of the questions and get the high points out of it. I know just to jump on real quickly, since Jenny is still here and on screen, I know everyone is asking Jenny the specific details of how to get those wristbands and all of that. So I don't know if you can provide them with that, or okay, with that information. Awesome. All right. Well, the first question, kind of the most asked question, was the curriculum question. So I want to make sure that gets addressed. Kaylee, I know that you talked about the prevention resource centers. Do you mind sharing that a little bit again, and the specific curriculum? And I can put the link to the website where everybody can find their county and their prevention resource center while you address that, if you don't mind.
Sure. Thanks for putting that link in the chat. I will preface this by saying I don't personally oversee this program, so I'm definitely not an expert in this area. But if you have specific questions, please email me, and I'll make sure that someone from HGSC can answer your specific questions. But like I said, we have different providers across the state of Texas that offer different curricula. It's focused on mostly protective factors like building social emotional skills, coping strategies, things like that. So it doesn't specifically address fentanyl. But that website is a good one to see what providers are in your area and which curricula they offer.
All right. Awesome. Thank you. And I know that Barney has been great with answering a lot of the question and answers in the box there. Barney, if you don't mind just coming off me and kind of repeating, I know there was many questions that was specific to, is TEA going to provide or create a curriculum for fentanyl use? And I know you answered that question, but just in case for those that can't see the chat and because this is being recorded, if you don't mind repeating it.
Yes, ma'am. So House Bill 3908 of the 88th Texas Legislature didn't give the agency the authority to approve or select any curriculum for the statutory requirement. And actually it directs the selection of instructional materials and curriculum that are required to meet the requirement to the actual local district. The bill that was signed into law amended Texas Education Code 28.004 subsection C7, which adds to the duties of the local school health advisory council to include recommending appropriate grade levels and curriculum for instruction regarding the dangers of opioids, and to include instruction on opioid addiction and abuse, including the addiction and abuse of synthetic opioids such as fentanyl. So the selection of the materials and then the grade level that the instruction would be taught would be up to the local shack to make those recommendations. So technically it's a local district decision to come up with those materials. And then some people may out there be thinking, well, you said it's up to the local shack to select the grade level, but the law says it's got to be taught in grades 6 through 12. That is a very good question, you might ask. So technically in that situation, the law is going to trump the grade level that the shack would select. So if the shack says it's got to be elementary school, technically it can't be elementary school because the law says it's got to begin in grades 6 through 12. So if the shack selected a grade level between 6 through 12 for the instruction to happen, then they would partially be correct, but the law would still trump the recommendation of the shack because it says the district must annually offer the instruction to students in grades 6 through 12. So it still would have to be offered annually to all students in grades 6 through 12, but the shack is still the local body that would make that selection of the curriculum and materials that you would use to teach or implement to address the requirement.
All right. Thank you, Barney, for that. I appreciate that. I was wondering if our Channelview and Bakota friends wanted to come on, and I know you talked about like Botman's life skills and positive action and things like that. You want to just share real briefly just kind of your process of how you picked what curriculum was right? Because I remember in your presentation you had talked about that.
So to be perfectly honest, we have a list that is approved by the state, which is our funder by HHSC, and we have to stick to what's offered on that list. We are, as it stands right now, we just got our request for proposals for the next 5 years. So we're in the process of doing the preliminary work for another 5-year grant. But we have to stick to what's on that list. We had the luxury with Channelview to pick outside of that list, but Botvin's was a great fit and we look at the availability of the students, how often it needs to be taught per week, how long each session is. All of those things play into how much access do we have from the students. So it's very much a partnership. You have to have those discussions with the district because they know the schedule, they know their requirements, and then we can look at what's a good match for that. They are basically character building curricula. They are not drug specific, which again addresses the risk and protective factors and not so much any just one substance. So I know that there used to be like a national list for curricula, for evidence-based, research-based curricula. And it will, if you look up the curricula, if you go to positiveaction.net, you can learn everything about positive action. So go to the websites, go to their websites, learn what you need to learn, make sure it's a fit for your population, and then go from there. I will tell you, there is not a one size fits all, and it shouldn't be. It shouldn't be a cookie cutter approach that everybody gets the same thing. So you want to do your research, you want to partner with your district and really get to know what it is they want and they're looking for.
So while I have you on screen, can I ask another question? I know there were questions. Some do not offer help in certain grade levels. Will you talk a little bit about how or what classes that you utilize to deliver this curriculum?
Sure. So again, and Dr. Wilson, you might want to speak to this because you're more familiar with and aware of when and where the kids are available to us. But there are certain things that we cannot do, one, because of our funding, and two, because of the district. So Dr. Wilson, do you want to speak to that?
Yes, so we typically pull students more so in a small group setting, and that is typically done coordinated with the school administrators and the counselors to be sure that that is provided. We also, in our shack, has adopted a program for the entire school body, but what our work with Bakota is more specific to groups of students. Some of the presentations that they do provide our whole school, but when it comes to like curriculum and the teaching pieces, those are for more of our small group, like tier 2, tier 3 type students that we're working with.
Thank you. And so for our mental wellness team, Ashton, did you want to talk a little bit about anything as far as best practice lists or?
Yeah, sure. I can say that we do have because of Texas Education Code 38.351, at the agency, we have developed a best practices and programs repository, which is made up of all research-based practices and best practice-based programs. So and on that best practices and programs repository, we do have a filter related to substance abuse prevention and intervention. So that is a great place as well to find some research-based programs and best practices that are out there, as well as the school mental health resource database. The Texas School Mental Health Resource Database is another great and phenomenal resource to find resources that are local to you, like in your region, as well as some statewide resources. And I also want to just echo everything we've all been saying about HHSC being a very big player when it comes to getting those programs and practices into your schools as well. So I would just direct you all to our HHSC colleagues too. And I can definitely drop in the chat the links to the repository, the School Mental Health Resource Database. And all of this will also be in the recording and all of the material that we post as well at the end of our session on our schoolmentalhealthtx.org website. So if you don't get a chance to collect everything now, it will be posted and saved for you. Just visit our website.
Wonderful. Thank you so much. So another burning question that has been asked by many, and we continually mention SHAC, the School Health Advisory Committee. The questions are, talk about what role does the SHAC have as it relates to substance prevention. So Barney, I didn't know if you wanted to address that first.
So the law, the law is specific in what the SHAC's role is, and the law specifically states that the SHAC is to recommend the grade levels in the instruction. So the SHAC would make that recommendation to the board, and then then depending on then there's various levels. So really it's as simple as it is specifically identified and pretty clear on what the shack's role is in 28.004 subsection C7. I mean, that's what the shack's role is. I mean, is there, or is the person asking the question, or I mean, are you looking for something different? I mean,
The question was pretty broad, was just describing the role of how Shack plays a role in substance prevention.
because subsection C lists all of the job duties of the shack. So, I mean, the shack is there to, make sure that local community values are represented in any decisions that are being made regarding health education. And then subsection C pretty much lists all the job duties of the shack and what the shack is required to do. And then, it gets down from there where, the shack's responsibilities regarding human sexuality instruction, and then the shack's responsibilities regarding child abuse prevention and intervention instruction, where that talks about child abuse, dating violence, family violence, and human sex trafficking. So, 28.004 is the shack. There is a shack guide that's on the DSHS website, but 28.004 is the shack law guide for everything that would pertain to a shack and what their shack duties are and responsibilities, and what would pertain to a shack and what they're required to do.
Okay, thank you, Barney. Channel View, I don't know, do you want to step on and just talk a little bit briefly about how your shack has been involved in your process and your partnerships?
Yes, absolutely. So what we did is just like most shacks probably have done, we did look at the various resources and curriculums that were out there. And then we sat down as a team and vetted those and decided whether, what was the best fit for Channel View. And we also looked at, what grade levels were we going to approach certain topics and how we were going to do that. And then how we were going to collaborate with our elementaries and our counselors to present that information to students as well. So that's kind of the process that we've gone through. And again, like I said, our partnership with Bakota is like in the icing on the cake, to be able to have those tier 2 and tier 3 supports for those students. And then on our high school level, just really having that prevention in there, because of course that's where we see most of our substance use issues.
Yeah, I appreciate that. Does anybody else have anything in regards to the shack and substance use prevention? If not, I'll move on to one more question. And let's see, Kaylee, this question might be kind of directed to you. And I know you addressed this in your presentation, but the question is on the legislation, the 629, the Narcan bill. And I apologize, I have lost the question. It skipped as someone has scrolled. But do you mind repeating just a little bit of the 620? Oh, here it is. The Senate Bill 629 regarding the maintenance, administration, and disposal of the opioid antagonists, and then including the training school personnel, school volunteers. I know you mentioned that in your presentation. Is there anything else?
Yeah, I can talk about it a little bit more broadly. So that bill directs certain schools to develop a naloxone administration policy. DSHS is working on establishing rules that will set the minimum requirements for those policies. I believe last I heard, the rule should be adopted and posted by the end of this month or maybe next month. And then the law goes, schools will be required to adopt it by January of next year, I believe. So that's related to the policy. Schools will also be required to train staff in overdose prevention. And I believe the rules will also establish the minimum requirements for those trainings. We do have a TTOR funded program that currently provides training that you all can get access to. once I stop speaking, I'll drop the link in the chat, but it's virtual. It's really easy to attend. And you can do it whenever, you have time. So I would recommend starting there and then keeping an eye out for those rules that should be published very soon.
Okay, thank you. I appreciate that very much. All right. Well, it looks like it is time. Hopefully we
But
have
this-
answered.
Can I interject something there
Sure,
to add,
Marty.
add to Kaylee's comments? The rules for Senate Bill 629, the bill states that they got to be posted by November 1st.
Okay.
And they're on track for that. And I would just thank everybody, Tammy, as you close, and just remind everyone, this is the first year out so we can all kind of take a deep breath with some of these new laws and new rules. And I just really want to compliment our panelists, our presenters, our people who came here to share and learn as we are just a few months, what are we, 5 months out from the, from when some of these bills passed, and the resources, the richness of what's been developed, the richness of what some of you have been doing for years. I want to thank you, and then how you build on and how you're building these partnerships together, how you're filtering and working with your shacks and your communities to wrestle and figure out what's best for you. We just want to really thank you for that effort, because we know it takes effort to dive in and make decisions about what works best for every community. Appreciate y'all doing it. Thank you for coming. We're going to have these on different topics each month. We'll stay on the list. And Tammy, you want to close her up?